Did you know that the types of cancers that occur most often in children are different from those seen in adults? They affect the body differently. As the American Cancer Society says on its website, childhood cancers are often the results of DNA changes in cells that take place very early in life, sometimes even before birth. Unlike many cancers in adults, childhood cancers are not strongly linked to lifestyle or environmental risk factors. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Joining us now is Dr. Don Eslin, who is a pediatric hematologist oncologist with Arnold Palmer Hospital for Children, to continue our discussion of various childhood cancers. Dr. Eslin, thanks for being with us.
Thank you so much for having me.
So your specialty is diseases of the blood and cancer.
Correct.
Not blood cancers.
Correct. We do take care of children with blood cancers, but we take care of all aspects of cancer and blood diseases for children.
What are the most common cancers that you see in children?
So the most common form of childhood cancer is leukemias, which are cancers of the blood, followed by brain tumors, and then followed by most other forms of cancer. Leukemias account for about 1/3 of all of the children that we see with cancer. Brain tumors approximately 25%. So the two together encompass more than 50% of all of the cancers we see.
What is going on? I mean, is there research or is there something that can point to why the numbers are so high, specifically leukemia? Is it genetic? Is it environmental? What's going on?
Very good question. We don't really know for sure. People have looked at that question for more than 40 years and have tried to understand what causes these issues for children. It doesn't appear that there are too many significant things within our environment, although very small cases there have been, such as when the nuclear accidents occurred, that increased the risk for cancers in children. But in general, for children across this country, the number of children coming down with cancer is higher because the population is higher, but the percentage of children over the last 40 to 50 years really has been fairly steady.
Okay, we know more and we're hearing more about it.
Yes, and the actual chance of being cured is higher, so there's a lot more in the way of children now being exposed from a public standpoint of us understanding it, because we see them out in public now with the ability for them to have survived all of this that they have to go through.
As an oncologist, do you treat cancer in a child the same way you would an adult? And if not, what's different?
So the types of cancers are different in children than in adults, although some have the same names. Even leukemias seem to be different between children and adults, so treatments are somewhat different. However, the basic treatments are the same. We have the ability to do surgery, we have the ability to give chemotherapy or medicines for treating cancers, and we have the ability to give radiation therapy.
Do children tend to respond better than adults?
Children very much respond better than adults. Children, when they were first started being treated for cancers, most people thought they couldn't handle the actual treatments, and so treatments for children were very much behind the times in the 1950s and beyond. When they realized that kids could in fact handle, especially chemotherapy, the cure rates for children started climbing drastically.
So let's talk about spotting it. How do you know, if you're a parent, if your child has cancer? If there is no family or genetic history to make you even be on the alert?
That is a very difficult thing for parents to understand. The signs and symptoms that occur at the beginnings of a cancer often are very similar to routine, normal problems children would have.
Such as?
Fevers that may come and go. They may have occasional complaints of pain. In some instances, they have no symptoms at all, especially for problems like large solid tumors. They may be quite large, especially if they're in the abdominal cavity, before someone can ever feel them. I have seen children who are 2 and 3 years old who have a football-sized tumor in their abdomen.
How is that even possible for a little body like that?
It is amazing, but you can hide very large things inside your internal cavity without anyone actually knowing they're there.
So for those symptoms that sound like the usual childhood ailments, the fevers, the aches that could easily be connected to a bad cold or the flu, when does a parent know something's wrong and we need to look at this a little more deeply?
So if they're worried that symptoms seem to be going on too long, a head cold, fevers shouldn't last more than 5 to 7 days for a routine infection. So if fevers are going on beyond that, they really should see a physician and have someone check and make sure that they can't find another reason for the fevers. Okay. Or if they can find a reason that's infectious, that at least is helpful. Same thing if they have ongoing aches or pains. Kids get minor aches and pains and they may come and go. But if it becomes more persistent, then someone really should see them and have it checked out.
And is there always, or should we look for a family connection?
So there are very rare cases where a genetic problem can lead to someone being at risk for cancers. There are higher risks in adults, especially with problems like breast cancer and colon cancer. There are well-known genetic syndromes associated with that. In children, there is a small risk, but really not a huge risk. There are few things, though, in families where if there are many different types of cancers, especially in young people, whether children or young adults, that should prompt someone to think perhaps there is a genetic, what's called familial cancer risk.
But often this is just a case of a cell gone wild with one child, with no other family member connected.
Correct. Almost all cancers in children really appear to start as a single cell that had a genetic mutation inside that one cell within that child. And it was eventually able to grow enough to become a tumor or blood cancer that allowed that to then finally be recognized as a true malignancy.
So what's the most exciting thing for you right now as an oncologist?
Well, the most exciting thing for me is the research that's being done. Although we have very limited resources for doing research in children, with what little bit we've been able to do, we've accomplished great things. Cure rates have changed from less than 10% 50 years ago to greater than 75% today. And we hope that someday in the very near future we get to that 100% mark. And I would really love for someone to get there and put me out of business.
Wow. Well, I hope that happens, but yeah, that would be a mixed blessing.
It would be.
Thank you, Dr. Eslin.
Thanks for inviting us.
From 10 to 75%, I think that's a perfect way to end this interview on a high note.
Thank you.
Okay. We will be back right after this. Don't go away. Most high school students are busy connecting with friends, playing sports, or video games. Our next guest might be doing some of that, but Nancy Pickett also has a passion for making a difference through documentary films that she produces. She and her partner Sydney set out to create a film to help raise awareness about pediatric cancer. Nancy, thanks for being here.
Thank you for having me.
You're 16 years old and you're a filmmaker. And we're not talking about a 2 or 3 minute piece. You're making a movie. Tell us how that whole thing got started.
Well, around January of last year, I felt really called to work in pediatric cancer and work with a charity called Base Camp that I had heard of before, and I had seen on social media through some of my friends who had volunteered with them before. And I started working with them and meeting some of the kids and volunteering at, they have overnights where high schoolers can be kind of camp counselors for a night that they get to spend away from the hospital. And I just really saw a need for awareness about what these kids were going through, because what I had heard about pediatric cancer was kids who have lost their hair and get to go to Disney for free, but that's really not the reality of what these kids are going through. There's so much more to that, and I realized that people don't know that, and people don't realize what they go through every day.
So tell us what we learn in your film that people don't know.
Our film is trying to show the truth behind pediatric cancer, what happens behind the closed doors of the hospital that you don't always see, the stuff that people turn away from because it's too sad to look at, but that really needs to be shown if you're going to get a good idea of what pediatric cancer is.
Tell us what some of those things are.
Chemotherapy is basically a poison that they put in your body to attack cancer cells. But since we're not completely sure about how to treat a cancer or what cancer does to develop, a lot of chemotherapy doesn't only target cancer cells, but it also kills the regular cells in your body. And a lot of pediatric cancer treatment is just adult cancer treatment that we've altered to put in a child's body. So chemotherapy has a lot of side effects. Of course, some kids lose their hair, not all of them do, but that's a pretty common one. But there's also really dangerous heart problems, really bad kidney and liver side effects, hearing loss, growth defects, and probably the scariest one is secondary cancers that can come out of your chemotherapy treatment that's targeting your one cancer can make you develop another one.
Your film is called The Golden Truth. Why that title?
The Pediatric Cancer Awareness Ribbon is gold. A lot of people don't know that, but I mean, orange is leukemia and purple is neuroblastoma, and there's lots of ones for specific types, but the childhood cancer one is gold, and the parents of pediatric oncology patients kind of decided that as our kids are worth more than gold. So we decided on the golden truth because we want to show the truth about pediatric cancer.
Well, when Tally was 7 years old, and of course she was diagnosed with cancer, she would, of course, no eyebrows or eyelashes, and so she used to draw her eyebrows on and real thick eyeliner, and she would say, "How do I look?" And I would always say, "You know, you look pretty," you know, and it made her feel pretty. And people would say, you know, "Why are you letting her wear makeup?" So I went to her doctor, Dr. Estlin, and I said, "You know, she's wearing makeup. What do I do?" And he says, "So what? Let her. She's having fun. Makes her feel good." And I said, "Great, that's what I'll do." So I encouraged her, and she just started watching makeup tutorials, and she actually got better and better and better. And then she started doing YouTube tutorials and makeup, and then she started talking about her cancer, and I think that was a good way for her to express what she was going through.
And I'm actually in the hospital again.
I use the radiation to kind of maintain the pain, not necessarily like try to get rid of the cancer.
Because she would wear wigs at the beginning, which she didn't have any hair, and they itched and they were hot, and she said she just didn't feel comfortable in them. So when she started wearing her makeup, she started feeling confident, and she can express herself through her eyes, and you know, it was just, she felt good about that. So that's when she came up with that slogan, "Makeup is my wig," because it was her way to kind of hide and take the focus off her bald head, so the focus was on her beautiful eyes or her eyebrows and her lips, and so she felt really beautiful with that when she had makeup on.
So this film is it's not lightweight, it's heavy duty stuff. Where is it going to be shown, and how are you going to distribute it?
We've partnered with a couple of local charities called Base Camp Children's Cancer Foundation, and they're affiliated with some bigger national organizations, and we're hoping to let them use smaller clips of our film for fundraising and campaigns for pediatric cancer funding, and we're also hoping to submit it to a couple of festivals and get it distributed so people all around the world can see it.
So what do you want people to come away thinking or knowing or doing as a result of seeing your film?
I hope that people stop turning their heads away from our kids and realize that this is something that's really important, and that we need to be a voice for the kids who can't always be a voice for themselves, so that eventually we can find a cure and be able to help the kids who are going through this and have better lives.
How did this process change you?
Oh wow, that's a big
question. Yeah.
I mean, I guess from working with Base Camp and working with the kids that I know, I got a better understanding of how to really live life to the fullest, and how to realize to be grateful for things that you wouldn't think to be grateful for, and just it's really inspiring to see them be able to go through something that is completely unimaginable and do it with a smile on their face, and just to I'm sorry.
It's okay. It's okay.
Just to really appreciate everything that you have.
Well, we appreciate what you're doing, because this was a big project to take on, and to be so young and to take on a topic that has such a big impact on people's lives. Congratulations.
Thank you.
Especially when it comes to getting your film distributed. Are we going to see you on an Oscar stage someday?
I hope so.
We're going to keep our fingers crossed.
Fingers
for that.
crossed.
What is next for you?
I would really like to graduate high school and go to film school, and hopefully make some more documentaries in the future that make a big difference.
So, and you're a sophomore, so you've got 2 more years of high school.
Yes, ma'am.
You are really going to be dangerous by the time you get to your senior year.
That would be cool.
It would be very cool. Well, Nancy, thank you so much for being with us and sharing your project. It's called The Golden Truth About Pediatric Cancer, and it is a full-length feature film, and we will be on the lookout for that.
Thank you.
Thank you. We'll be right back.
Talia's one wish was to find a cure for childhood cancer, and she said, Mom, I want you to promise me, you won't stay in your room and you won't cry, and you'll be out there and try to find a cure, because no child should have to go and suffer the way I did. So her sister Medea and I started Talia's Legacy Foundation. It's a childhood cancer foundation, and we advocate, of course, for awareness. And we have fundraisers, and we support clinical trials and research. And we also have a program called Glam Wars, and we help children feel beautiful, just like Talia did through CoverGirl Makeup, who CoverGirl has sponsored all the makeup for these Glam Wars to help these kids feel beautiful. And so Talia's legacy is to help find a cure for childhood cancer and bring joy along the way. That's our mission statement.
You can never have too much awareness or education when it comes to the diseases that impact us all, especially pediatric cancer. But with young people like Nancy who are getting the word out in a bigger way, hopefully it will help researchers make a dent. Thank you for joining us for this special edition of Healthy Connections. I'm Annetta Wilson. Join us next time.